2017 legislative agenda. So in the 1970s, activists in California worked really hard to cut concrete paths into sidewalks. They were working very closely with folks in wheelchairs, and they wanted a way for people to move accessibly in wheelchairs from sidewalk to sidewalk. And that was really the start of the movement to making our sidewalks ADA accessible. And it's something we take for granted to this very day, curb cuts throughout all of our sidewalks. And one of the things that is important about that is that we have a lot of folks that benefit from those curb cuts that aren't necessarily in wheelchairs. So a great example, parents who are wheeling their strollers with their babies in them can easily move from block to block because of the curb cuts. Families who are going off on a vacation that are wheeling their suitcases and taking the bus to go on vacation, they can wheel their suitcases. Skateboarders and rollerbladers can easily go from block to block because of curb cuts. And from my perspective, a project, Curb Cuts, that was designed to impact a vulnerable population has really benefited a broader array of folks. And so that's the underlying philosophy of my package for the 2017 legislative session. My goal is to make sure that we are supporting our struggling Oregon families as well as benefiting everyone. So key areas, number one, continue to stay focused on creating what I call a seamless system of education from cradle to career, focusing, of course, on making sure that every child graduates with a plan for their future. For me, I think you all received the report this morning about how we're doing in terms of our graduation rates. Over the last 3 years, we've seen a 3% increase in our graduation rates. I think there's more work to be done, but it's really clear that what we are doing is working, and that's why I'm very pleased in my package for the legislative session to have a $20 million graduation equity fund. Secondly, I've been saying time and time again that healthcare is fundamental and foundational to Oregonians' well-being. At my inaugural address, I shared the story of the Camacho family. Mom ended up working with the Coordinated Care Organization in Jackson County, Jackson Care Connect, to have access to an exercise program called Healthier You. As a result of the program, she lost a lot of weight and has seen great benefits to her health. But it wasn't just her that saw the benefits. Both her husband and her son lost substantial weight as well. And her 16-year-old son, Carlos, he ended up getting engaged in wrestling. And now because he's engaged in wrestling and his wrestling coach wants to make sure that they're going to school and got good attendance, he's also becoming a good student. So we've seen where one program has been able to benefit an entire family, and we're seeing the success not just in terms of healthcare metrics, but also in terms of educational metrics as well.